welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the executive producer, and I am back in the Sunflower House for a very new episode on diabetes. And November is National Diabetes Awareness Month. So on this podcast episode, we're going to talk all about diabetes. And the reason why November is Diabetes Awareness Month is because it takes place during the birthday and in honor of Dr. Frederick Banting, whose birthday was November 14th. And as you may recall, it was Dr. Banting who discovered insulin in 2021. When I frequently talk to women about menopausal hormone therapy and hormone deficiencies, I'll use the example of type 1 diabetes. So prior to 100 years ago, when we started to use insulin, no matter what anyone did, if someone developed type 1 diabetes, within 2 weeks, that person was dead unless they used insulin. So that's a dramatic example of a hormone that you cannot go without for very long. Now, in this current age, in 2024, we have the option in some patients for pancreas transplants to cure type 1 diabetes. So the reason why I mention that when I talk about menopausal hormone therapy is because when you lose estrogen, either naturally because of menopause, which happens to everyone if they live long enough, or due to oophorectomy, removal of the ovarian tissue glands, you don't die in 2 weeks like with insulin deficiency. You don't go into a thyroid coma within several months of not having any thyroid hormone, but you do shave off at least 2 years, if not more, of your life from accelerated aging. So getting back to sugar diabetes, and the November being the National Diabetes Awareness Month, and it's also prostate cancer awareness and also pancreatic cancer awareness. And we'll certainly have podcasts on cancer. But on this episode, we're talking all things diabetes. And the American Diabetic Association suggests that we screen all Americans by age 45, particularly if you're overweight, if your BMI is over 25, or you have increased fat mass, or if you have one or more risk factors. And if your fasting blood sugar is normal, less than 126, or you have a normal 2-hour glucose tolerance test, then generally speaking, we rescreen about every 3 years. Now, in younger women who are pregnant, we routinely will screen for gestational diabetes. And anyone with gestational diabetes, a family history of diabetes, syndrome X, which is associated with truncal obesity, elevated triglycerides, elevated blood pressure. It's usually a problem of way too much sugar and carbs and insulin resistance. Now, we're mainly going to be talking about the common type 2 diabetes as opposed to type 1 diabetes. So the first line treatment for diabetes as well as prevention of type 2 diabetes, the insulin resistant type, is a healthy diet and exercise. In fact, the largest study on type 2 diabetes shows that exercise, healthy diet, and weight loss, maintaining a normal BMI, reduces the hemoglobin A1C by almost as much as medication, if not more. Now, one of the first line treatments for type 2 diabetes is metformin, also known as glucophage. And that is actually anti-aging. And we certainly will have discussions and further podcasts specifically on anti-aging, kind of so-called hacks to stay younger. I think that one of the biggest ones is for midlife women and beyond is estrogen and hormones. And certainly maintaining an excellent metabolic profile for both sexes is very important. And so before you can prevent something, you have to have awareness. And so let's dive right in to what is diabetes. Well, it's a serious condition that prevents your body from properly using the energy from the food that you ingest. And it can occur if the pancreas, which is the gland, retroperitoneal gland behind your stomach, and it produces little or no insulin, or it makes insulin, but the insulin made doesn't work exactly like it should, which is called insulin resistance, which is the most common type of diabetes. And sometimes type 1s can have some type 2 overlap, or type 2s can turn into type 1. It can be complicated, but for most adults listening, especially if they have a family history of type 2 diabetes and they have that apple shape to their abdomen with fat deposition around their internal organs, that's the most common one. So, to understand diabetes better, we want to know more about metabolism and how we use food for energy and how we specifically use glucose. Your body is made up of millions of cells, and to make energy, the cells need food in a simple form. And when you eat and drink, that nutrition is broken down into a simple sugar called glucose. So you can get glucose from carbohydrates. You can get glucose broken down from proteins. And interestingly, the only really of the three major energy groups, fat, protein, and carbs, there's only essential fats, of which there's two, omega-3 and omega-6. And we've had a podcast on omega-3 fats from season 1. If you haven't heard that, that's a great one to listen to. And we have essential amino acids, which are the building blocks to protein. There is no such thing as essential carbohydrates. And as carbs have been introduced, sugar, sweets, high fructose corn syrups, processed foods with lots of additives, we've certainly seen an increase in diabesity, which is diabetes and obesity. So the blood and the blood vessels that are the highways that transport glucose to where it's absorbed, manufactured. It can be manufactured and stored in the liver in the form of glycogen, to the cells where it's used. If it's not used, it's stored as fat. And glucose cannot just enter your cells by themselves. You must have insulin. And that's why we have our pancreas, to release insulin. And if you have too much insulin and insulin resistance, it's a big, big problem. Without enough insulin, or insulin that works correctly, glucose will not get into the body cells, which causes the sugar to rise really high. And too much sugar in the blood is called high blood sugar. We mentioned that type 1 diabetes occurs because there's no insulin, because the beta cells of the pancreas have been damaged. And that is really a medical emergency. People with type 1 diabetes must use insulin to control their blood sugar. And we started out first with animal insulin. Now we have human insulin, and now we also have pancreatic transplants. The symptoms of type 1 diabetes may occur over a period of days to weeks. I remember a friend of mine I was sitting with, we were watching our sons play basketball. She was telling me how one of her twins just seemed fatigued, was constantly drinking, and his basketball game was so off. Like simple, easy shots that he previously usually always made were just, totally air balls. And he had type 1 diabetes. And it is the most common cause of diabetes in people under age 20, but it can occur anytime in life. Unlike people with type 1, people with type 2 produce insulin, but it just doesn't work properly, or it's not used like it should. And this is more common in people who are over the age of 40, midlife and beyond, and folks at all ages who are overweight. And unfortunately, we're seeing it at younger and younger ages, which really has rapidly increased, which really gets to lifestyle and diet. Some can control things with diet and exercise, but others may need to take medications, sometimes even including insulin, which we really like not to have to use in type 2 diabetes because it can cause weight gain. Now, gestational diabetes is of special interest, and we have an excellent column on gestational diabetes by Dr. Yogi Morin. So if you don't have speakingofwomenshealth.com bookmarked on your computer or iPad or phone, please do that. And if you're pregnant or you know someone who's pregnant or someone who's had gestational diabetes or babies over 9 pounds, it's very important to understand why this occurs more often in pregnancy and how we treat it and what it means for the rest of your life. And certainly, all the marked hormone changes during pregnancy also affect the action of insulin. With my 3 sons, of course, I always had the glucose tolerance test. I was essentially the same weight. Thankfully, with all 3 of them, essentially gained the same amount of weight. The only difference was age. And with my third son in my 30s, my tests were normal, but I saw the numbers creep up, still in the normal range, but still creeping up. And I think it's very important, even when your labs are normal, just to keep records and just to compare. And some of my patients are really good at this and they have all their biometric numbers. Now that there's all these Apple Watches that people have that you can check, your sleep time and your pulse rate. And some people even have monitors that can check for AFib. I think we're getting better and better at, measuring uh, physiologic and pathophysiologic outcomes. And the more you're involved in knowing your own health indices and understanding how that works, I think that more it empowers you to be strong, be healthy, and be in charge, which is our motto. So, the pregnant women who have an increased risk of developing gestational diabetes include those who are over 25. Age is a risk. A lot of women don't realize that your peak fertility is at 24. So a lot of women don't even get around to thinking about pregnancy until they're 35. And our birth rates in the United States are so low. I was just reading a statistic that we now have more adults between the ages of 18 and 55 who are single and without children than we have people that are married with children. So you might look young and feel young, but that biological clock is ticking. Also, for anyone with a BMI that's above 27 for sure, especially if it's not due to dense bones and thick muscles, which in some athletes and mesomorphic people it is. If you have a family history of diabetes, very important to know that history. If you're of a certain ethnic background, particularly Native American, Hispanic, African American, as well as Asians, and a lot of people who come to the United States, which has so many different people from various countries and backgrounds. Our American lifestyle is harder on certain people with certain backgrounds. And, like, for instance, I have patients in my practice who are of Asian ethnicity, and their body weight is technically normal, but the percent of fat is higher, the so-called skinny fat, and they cannot tolerate any extra adipose. Many people that it really throws their metabolic system off. So, if possible, if you're not adopted, if you can communicate with your biological relatives, know what your family history is. And with Thanksgiving right around the corner, it's a kind of a good time to get family history. Now, with gestational diabetes, usually the blood glucose levels totally return to normal after childbirth. But if you have personally had gestational diabetes, and I always ask all my patients their obstetrical histories, you have a much higher risk of developing type 2 diabetes. later in life, as well as a higher risk of obstructive sleep apnea. And last year's um, Labor Day, I did one on labor and pregnancy and talked about a lot of things that happen in pregnancy that have outcomes later in life. So that was in the fall of 2023. So, what are the symptoms of type 1 diabetes? Well, as I mentioned with my friend's son, it could be thirst and hunger and dry mouth and fatigue and weight loss, unexplained urination, blurred vision because of the high blood sugar, even sometimes numbness and tingling of the hands and feet. And if the person gets dehydrated, they may actually even pass out or have syncope or loss of consciousness. Now, the symptoms with type 2 can be very similar, but it's usually a lot more gradual and not as acute. People can notice they just don't heal as well. Their skin might itch. They may have more vaginal yeast infections. And in season 1, if you haven't listened to the podcast on vaginal infections and yeast infections and caring for your vulva, in fact, caring for your vulva, I think, is one of the top searched columns on our Speaking of Women's Health website. Recent weight gain, having those diabetic risk factors or syndrome X risk factors. Some of the risk factors that can increase your chance of developing diabetes is a family history, particularly parents, siblings. We talked about the ethnic backgrounds. We talked about a higher BMI, especially being 20% or more above your desired weight. If you have essential hypertension, elevated triglycerides, we really would like the triglycerides to be under 150, even under 100. And that triglyceride level, I think, is even more important than the cholesterol level. And if your HDL, so-called good cholesterol, is under 45 for men, unless your overall total is so low. I remember my youngest son with great metabolic indices had his lipid panel done for the first time, I think, when he was a teenager, and his HDL was under 45. And the pediatrician wrote him a note, "Oh, you need to exercise more." Well, he was a varsity, state recognized athlete and going on to play college athletics. And so he was really getting lots of exercise, but his total cholesterol was so low and his LDL's low. So you have to look at the whole picture as opposed to only following some cookbook protocol. For women, because women have estrogen and estrogen boosts HDL cholesterol, we usually like to see it over 55. So some of this is genetic and we can't change your genetics. Some of it's lifestyle. Weight gain drives down HDL. Smoking drives it down. Lack of exercise does. Age tends to be an increased risk for lots of conditions. Certain medications can do it. Thiazide diuretics, which I'm generally quite a fan of because they're cheap and safe and they help the bone and they reduce calcium urine loss and they treat the blood pressure. They can slightly raise the glucose by a couple of milligrams per deciliter. But the big ones are things like steroids, prednisone, Decadron, Medrol dose packs, dilantin type medications, which also can be bad on the bones. Medications that our transplant patients need to take to prevent rejection, such as cyclosporin. And the big substance is social alcohol. And especially if you've been a heavy drinker and damaged your pancreas gland. Smoking as well, gestational diabetes history. Even if you haven't had gestational diabetes, when I hear about a woman having big babies over 9 pounds, it always rings a bell for me wondering about their insulin resistance status. Now, autoimmune conditions, things that affect your immune system, can also affect how you handle blood sugar. And autoimmune conditions can affect your pancreas cells in your body. Viruses can play a part in diabetes development. And any external substance, toxin, virus, agent that can hyperstimulate your immune system can increase the risk of diabetes. And sugar itself doesn't cause diabetes, but if you eat a lot of sugar, it's not really usually good for your waistline, and it tends to drive insulin, which makes you hungrier, which causes weight gain. And it certainly can lead to tooth decay. And there is no such thing as an essential sugar or essential carbohydrate. So remember that when structuring your diet. So you have been listening to the Speaking of Women's Health podcast with your host, Dr. Holly Thacker, and I'm the executive director of Speaking of Women's Health, and our executive producer, who you've heard as a guest podcaster, is Lee Kleckar, and she has done a great interview with one of our chefs, Jim Perko. Because anytime we talk about diet, people don't want to be on just a drab, plain, tasteless, celery and chicken and broccoli type of plain foods only. So that's why when we talk about diet, we like to talk about superfoods and herbs and spices, which really can impart actual benefits from the cardiovascular standpoint, immunological standpoint, antiviral, and as well as just make the gustatory experience more enjoyable. So, how is diabetes diagnosed? Well, if you suddenly experience thirst, excessively frequent urination, unexplained weight loss, you've got to think that your sugar's too high. And it's very easy to get a blood sugar test to do this. Many people that are diabetic do finger stick or have a continuous monitor that they have attached to their skin, especially type 1s or anyone who's so-called brittle or who can go high or low easily.
We'll be back after a quick break.
Are you ready to unlock your full potential? I want to introduce you to the Fit, Healthy, and Happy podcast, a powerful resource to transform your life today. With expert interviews, practical tips, and inspiring stories, this podcast is your roadmap to lasting wellness. Here's what a listener has to say.
I used to struggle with my health, but this podcast changed everything. It's like having a personal trainer, nutritionist, and life coach totally for free.
With over 2,000 5-star reviews, we're a podcast you can trust. The Fit, Healthy, and Happy podcast, available now wherever you get your podcasts.
We like to check fasting blood sugar because it's easier, it's less expensive. If you haven't eaten anything for 10 to 12 hours, it's usually between 70 and 100. Although I can tell you, if you're going keto for weight loss or you're burning fats and you're into ketosis, which can metabolically be very helpful, it's got to be done carefully. You have to have adequate electrolytes. I have done it, and when I did it strictly in order to lose weight to get into my expensive one-piece ski suit that I had bought over 25 years ago, was prior to me having 3 children, and I was determined to fit into it. I didn't want to buy extra clothing and equipment since I don't do snow skiing very often. I saw my fasting blood sugar go from the low 70s to 109, and that's called insulin sparing. So people who really strictly do intermittent fasting and really reduce the carbs may actually see their fasting blood sugar go up. So it's not the end all be all, because if you're not having to use as much insulin, which is great because you're resting your pancreas, you may see that go up. The standard diagnosis of diabetes is made when you just have 2 fasting blood sugars of over 126. Now, glucose intolerance, you might have a normal fasting blood sugar because the insulin's still working, but then the blood sugar really overshoots when you eat. And this is glucose intolerance, or so-called pre-diabetes. And you should really take that seriously. Don't wait. In fact, a lot of people, by the time they're diagnosed with type 2 diabetes, have had it for a decade and already have artery problems, peripheral nerve problems, and even kidney damage. And diabetes can lead to blindness, to kidney failure, to severe painful diabetic neuropathy. It's really a bad condition. So you really want to ward it off. If you have a casual blood sugar that you're not fasting, but it's over 200, your eyes should really pop out and you need to be evaluated at a later time. The oral glucose tolerance test is not done every day, but it is done in pregnancy, and I do sometimes order it when I want a better assessment along with fasting insulin levels. So we can treat and control diabetes. And we like it to go into remission, which is possible if you lose a significant amount of weight, get rid of the alcohol, put in more proteins and heart healthy fats, and stay away from simple sugar and sweets. I always love it when my husband is asked if he wants sugar in his tea, and he always responds, "I'm sweet enough." And regardless of your personality, if you're an adult and not a growing child, chances are you're sweet enough. And so pass up any gratuitous sugars, high fructose corn syrup. Now, I think there's a role, especially over age 2, not before that, because of botulinum spores potentially. But honey, natural honey, especially if it's made locally, may help reduce allergies. We use it when people aren't feeling well and have a sore throat and cough. So the bee pollen may have some benefits. So I'm not saying that you can't have some sweets or use natural sources. There's also some fruit sugars, monk sugar, and some sugars that don't spike up the blood sugar as much as just plain old sucrose, which is like table sugar. You want to maintain your lipid levels, especially your triglycerides. And you definitely only want to ingest heart healthy fats. Stay away from the seed oils, the processed cottonseed oil and soybean oil and canola and corn oil. Okay. Focus on high quality olive oil that's not adulterated with these cheaper, highly processed oils. Peanut oil is fine, avocado oil, and also uh, coconut oil, even though it can raise the lipids, but it has medium chain uh, triglycerides in it. And besides being good to moisturize your hair, which I I use coconut oil for that, it's also a good skin moisturizer too. Some women might use it on the vulva or olive oil as a moisturizer and lubricant. But there is certainly a role for those. But be really picky about the oils that you ingest. But don't be fanatical and try to avoid heart healthy fats because they lead to satiety. And you do need those omega 3s. When we do omega 3 or omega fat checks in the bloodstream, it seems like almost every American that we do that test in does not have the right ratios. And that's one of the things that our functional medicine people focus on a lot. So you can hold the keys to managing your own diabetes by prevention or treatment by planning what you eat, exercising regularly, doing intermittent fasting if you can, taking medicine if it's prescribed, following up with your appointments, getting your eye examined at least once a year by an ophthalmologist, diabetic foot checks, and keeping appointments and being organized, having all your information and data and your questions ready for your appointment. And what you do really can affect your blood sugar, and you can learn this by testing. Now, one of my columns that I've reprised a couple of times is 11 ways to lose midlife weight and prevent diabetes. And I start out by asking, are you pear-shaped in the female form with the bigger hips and thighs, or apple-shaped? So a lot of women don't like that pear shape. They don't want any extra weight. They want thinner legs and buttocks. But I'm telling you, when you gain weight, even a few pounds just in your abdomen, it's worse because it's associated with more visceral fat, elevated insulin levels, inflammation, which can cause joint pain and can lead to type 2 diabetes and heart disease. So we talked about the pregnancy risk factors, also polycystic ovarian syndrome or female hyperandrogenism. And if you didn't hear the podcast interview I did with Dr. Ula Abed in season 1 on PCOS, please go back and listen to that. She is quite the expert and has used dietary therapy actually to improve fertility in younger women. We talked about the genetic, aging, family history, physical inactivity risk. We talked about sensitizing your body to insulin by intermittent fasting and doing weight-bearing exercise. And if you have to keep making more insulin, you disrupt ovulation if you're premenopausal. And if your pancreas has to work twice as hard, it conks out faster. And keeping your insulin levels in the normal range and your blood sugar is so important. So, healthy diet, focusing on those heart healthy fats, olive oil, nuts and seeds, and avocado, omega-3 foods that are rich in EPA and DPA, like fish and flax, walnuts, almonds. I just had a few almonds before I started this podcast. Complex proteins, chia seeds, legumes, beans, and more complex carbohydrates like lentils and beans that also have good fiber content and good nutrient density. A lot of folks count carbs instead of calories. Most people find it easier to lose weight on a higher protein, lower carb diet than just a traditional low fat diet. There are exceptions, and I think there's a lot we don't know about dietary and genetic interactions. And certainly just to say it's simple calories in, calories out is not the whole story, because the type of food you eat can affect inflammation, can drive insulin, which can affect hunger levels. And if you haven't heard our prior podcast on weight loss and weight loss medications, which can dramatically put type 2 diabetes into remission, please go back and listen to the one in the beginning of season 1 with graduated fellow, women's health expert, and obesity expert who's now at Harvard and Brigham and Women's, Dr. Tara Iyer. Exercise. It's a powerful insulin sensitizer because it helps your muscles on their own take up sugar. So you need less insulin. I usually start out most of my days doing exercise. And if I particularly do a lot of aerobic activity, I am definitely hungrier because you get hungrier sometimes with aerobic activities. So the older you get, you have to make sure that you do the muscle bearing activities. You still need the aerobic activities, but you don't want to kind of shoot yourself in the foot by becoming too hungry. And exercise strengthens your muscles and helps your balance. And we've had podcasts on exercise. We've had podcasts specifically on if you're suffering with back pain and sciatica. That was a particularly popular one. There's a lot of different ways to do intermittent fasting, which will drop your insulin levels. It is insulin sparing. Like I told you, my own personal experience, my blood sugar went up, which on the surface you think would be bad, but it was really insulin sparing. And paradoxically, fasting blood sugars elevate slightly when you intermittently fast. So if you're concerned, you can get a hemoglobin A1C. But don't just say, oh, I better start eating carbs to lower my blood sugar. I unfortunately, after I fit into that ski suit, I did that. Now, bariatric surgery can actually cure type 2 diabetes. It's a pretty dramatic procedure with some significant complications in some, but it can be very dramatic. And I have had several patients who've just done everything that they could do, and they couldn't get control of their metabolic problems. And it's interesting because the diabetes can go into remission even before there's significant weight loss, because it really does affect a lot of gut um, neurotransmitters and hormones. But you still have to focus on exercise, intermittent fasting, diet, and medical checkups and doing all of that. So don't just try to reach for some easy fix rather than really looking into your lifestyle, the emotional triggers for eating, uh, what food has meant to you. I mean, for some people, they eat for comfort or emotion, and we really should be eating for sustenance, energy, and nutrition. Now, medications. Metformin glucophage is definitely an insulin sensitizer. It's anti-aging. It can sometimes help lower body weight. It has been used in women with PCOS to improve menstrual disorders and infertility. But really, the diet is more important than that for women wanting to improve their fertility. Now, berberine has kind of been in the news. It's an ancient remedy from traditional Chinese medicine. It's derived from plants, and it has interestingly broad range of pharmacologic effects. Um, it's from anti-cancer to anti-infective, um, but it can really be tough on the gut. People call it nature's Ozempic, but it's not Ozempic. But it can help lower blood sugar and certain blood fat levels. But you really need to do the lifestyle changes first. But it is interesting because it's natural. It is over the counter, but things that are over the counter aren't regulated. So buyer beware, look at lot numbers and expiration dates. Antioxidants, one substance that I will recommend to some people who are doing everything and still hitting a roadblock is alpha lipoic acid. And it's an antioxidant found in many foods. Check our website for foods that are high in alpha lipoic acid. And it is made in our body, and it does help improve insulin sensitivity. It's in foods such as spinach, broccoli, tomatoes, Brussels sprouts, beets. And beets and beet juice really are good at improving nitric oxide and helping lower blood pressure too. And alpha lipoic acid is also in meat. I think red meat has been too much demonized, just like I think eggs, which are an excellent source of protein, and choline, which is good for the brain. I think I've said in prior podcasts that my daughter-in-law, Laura, the mother of Artemis and Beatrice, says that Artemis is so smart because she ate so many eggs and had a lot of good choline intake during her pregnancy. Now, other supplements to consider, D-chiroinositol, which is a secondary messenger in insulin signal transduction. And D-chiroinositol is found in buckwheat farinata. So instead of just using regular wheat flour, which a lot of people don't tolerate for various reasons, if they're gluten intolerant or they have celiac, or if it drives their sugar up too much, you may want to try some buckwheat farinata. Trace minerals are important. Chromium is a cofactor in various enzymatic reactions, and it's involved in the regulation of blood sugar. Good chromium sources include black pepper. Oh, I use black pepper almost every day when I'm cooking, and thyme. I love that as a spice, and brewer's yeast. It's also in lean meats. And most people who live in the state of Ohio, which I do, our soil is relatively rich in chromium. And if you take too much chromium, it can be pro-oxidative. Spices. Cinnamon can reduce insulin levels, but you're talking about 3 to 6 grams, which is more than what you're just sprinkling, on your soup or on different dishes. So if you're going to use a lot of sugar, just putting a dash of cinnamon is not going to obviate the problems associated with too much sugar. Now, acetic acid, and I've talked about apple cider vinegar in prior podcasts and as like natural beauty hacks. It has been shown to improve insulin sensitivity because it suppresses the disaccharidase activity, similar to a prescription medicine called acarbose. So instead of a spoonful of sugar, it makes the medicine go down, the medicine go down, the medicine go down. Just try a capful of apple cider vinegar. I like to put it on salads and to use it in certain dishes. Now, you can still sprinkle your apples or pears with cinnamon. I'll add fruit to my salads and add cinnamon and nutmeg. You can put some sliced pears with cinnamon on your buckwheat farinata waffles. So, food can be healthy medicine, and really look to eating the right foods to make such a huge difference in how you feel. And you'll need a lot less medication and medical interventions. But for those people that do need medical interventions, those people that do develop type 1 diabetes, it's wonderful that we're living in 2024, because I have had patients with type 1 diabetes who have lived 50 plus years without complication and are living an active life. And that's our mission, to empower all of you to be strong, be healthy, and be in charge. Give us a 5-star rating too. That helps us move up in the charts. And you can always go to our website, speakingofwomenshealth.com, and hit the donate button. And you can go to the contact us portion on the website and ask us a question or tell us topics that you would like to hear about. And I'll see you next time in the Sunflower House.